Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic today in Neighborhood Health Watch is atrial fibrillation, a quivering or irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart-related complications. At least 2.7 million Americans are living with AFib. Dr. Barnett Gibbs with Henrico Doctors Hospital is here to talk about the significance of age and the increased risk for hypertension and heart failure in women. Let's start off with what is AFib and what's going on in the body when that's happening.
I think you described it very well. It is an irregular heartbeat. People think that maybe that's something that they can feel all the time, and of course that's not always the case. You can't always feel when your heart has an irregular rhythm of that nature. But what it is as opposed to a very normal rhythmic beat, it's a very irregular beat, and so being irregular of that nature, just like you said, you can develop blood clots in areas of the heart and potentially put yourself at risk for a stroke.
It sounds kind of scary when the heart is flipping around like that. We don't always know what's happening. Yeah. That is even scarier because you don't have any symptoms. What should you do when you do have symptoms?
If you do have symptoms or you're concerned at all, of course, the best thing to do would be to go to a medical professional as quickly as you can, either your own physician or to the emergency room in order to be evaluated. And a simple EKG or even feeling one's pulse, you might be able to recognize if you're in an irregular rhythm.
And what's the link with age and why are women most at risk? It seems like everything falls on women when it relates to the heart.
Sadly, you're absolutely right. Especially with stroke risk, women and the elderly are at higher risk for strokes. People with hypertension are at higher risk for strokes. People with heart failure are higher risk for strokes. So you're absolutely right. Unfortunately, women, again, have a higher opportunity of strokes in this instance.
And how do you lower your risk?
The best way of lowering your risk is with blood thinners, and those come in various types, the older ones being Coumadin, and then there are some newer drugs as well. All of them are very good at lowering the risk for a stroke. Nothing's 100%, unfortunately, but these drugs are very, very good at lowering one's risk.
And what can you expect when you see a doctor?
He or she is initially, of course, going to take a look at the EKG. Very likely you'll have some diagnostic tests of the heart. Nothing invasive per se, but they'll put you on some blood thinners and talk to you about risk factors.
All right, awesome. You know so much. Thank you, Dr. Gibbs,
Pleasure.
for joining us.
Thanks
We appreciate it.